Hello and welcome. Welcome to the interview. Tell me a bit about yourself. Who are you and why are you with us today?
Hello, thank you for inviting me to do this interview. My name is Fredrike Bannink. I'm a clinical psychologist. I'm also a lawyer. I live in Amsterdam, the Netherlands, I should say, not Holland. You should say the Netherlands. And I'm the author of several books at Hogrefe, among which two books that we're going to talk about today, aren't we?
Yes. Great. So you're in the field of positive psychology, and that's the two books that we'll be discussing today. So how did you get involved in this field and why is it valuable?
Okay, well, as a clinical psychologist, I have been working in a problem-focused way for many years. And what I mean by a problem-focused way, I mean that I use the medical model, which means that medical model is, so what's wrong here, what are the causes, and how can we repair it? That's a medical model, and that's a very valuable model. And also already in the 80s of last century, I came across solution-focused brief therapy, which was kind of a rebellion against the medical model. And they said, okay, we don't have to look at what's wrong with people. We don't have to look at the causes of what's wrong. Why don't we look the other way? Why don't we put the focus on the future, the preferred future? So we don't look back at what's wrong here, but we look at what's right and how the preferred future of people look like. For instance, already in the 70s, there was a psychiatrist, a famous psychiatrist. His name is Milton Erickson, and he already said to his patients, suppose I meet you in 6 months' time, and you're telling me you're doing better. So what does your life look like when you're doing better, and what obstacles did you meet, and how did you overcome those? And well, this is a fine example of how you can also look at the preferred future. Suppose I meet you in 6 months' time. Could be 2 years' time or 10 years' time, whatever. Well, he said to his patients, 6 months' time. And he found that when he asked these kinds of questions, that when he later on he met his patients again, people were actually doing better. So this is the solution focus. Then later on in the 90s, positive psychology started. And positive psychology, Martin Seligman, the founder, one of the co-founders of positive psychology, he said, we've been working all those years on making miserable people less miserable. How do you get people out of the minuses? But we forgot we forgot how to get them into the pluses. We stopped at zero. How to make miserable people less miserable. And he said there's another side on the scale. Where the pluses, and in the pluses is well-being, and that's when he started happiness theory, and later on it became the well-being theory. So what solution-focused brief therapy and positive psychology have in common is the fact that they don't stop at making miserable people less miserable, but they want to help and be useful to get the people they work with on the other side of the scale, in the pluses. And just to give you an example, suppose you have a garden full of weed, and you want to get rid of the weed. So after a lot of hard work, you've all the weeds. You've taken out all the weed of your garden. What kind of garden do you have? That's an empty garden. So chances are quite big that the weeds will grow back. So in order to make a beautiful garden with flowers or vegetables or whatever, you have to do more than that. You know, not only getting rid of the weeds, but you have to have soil, and you have to have manure, and you have to have sun and rain and whatever, and then you'll have a beautiful garden, and you get into the pluses. And even if a weed will grow into your garden over there, it's basically relatively easier to get the weed out when people are in the pluses. So that's a kind of metaphor, which you might say that positive psychology and now the well-being theory, and well-being is an important factor against relapse.
Okay, thank you. So you have 2 new books that are being published or have been published, which are the Positive Psychiatry and Positive CBT. So tell me a bit about these books and what are your main reasons for publishing them?
Well, after having worked for many years in a problem-focused way, like I told you before, I was not pleased with the outcomes. For instance, the fact that the #1 disorder in the world, depression, severe depression, I was shocked to find out that in the last 30 years, no progress has been made in all these therapies, not in CBT, not in any other form of psychotherapy. So it's basically my model of positive CBT is based on the fact that I was not very pleased at the productivity and, let's say, the usefulness of traditional CBT. I call it traditional CBT. I don't call it negative CBT. Some people say, if you do positive CBT, what we are doing is negative CBT. I call it traditional or problem-focused CBT because, let's say, the traditional CBT uses the medical model that I was talking about. What's wrong here? And it's about symptom reduction. And so what I wanted to do in my model is to put all the research and the applications of solution-focused brief therapy and positive psychology and combine it with, let's say, the CBT framework. That's what I did. And well, I've been doing that and I've been working since because I'm a CBT supervisor and trainer. I've been practicing it a lot, and at the University of Maastricht, which is in the south of the Netherlands, we did research on positive CBT, and we found that it works just as well as traditional CBT. But then we had a crossover design. So let's say the first half of all the clients that had CBT had problem-focused CBT 8 sessions, and then positive CBT 8 sessions, and the other half the other way around. They started with positive CBT and then they did 8 sessions of traditional CBT because of statistical reasons, and we found that whether people started with traditional CBT or positive CBT, it all worked. But then later on, the people who started with positive CBT didn't want to do traditional CBT afterwards, the 8 sessions. Whereas when people started with traditional CBT and after the 8 sessions they did positive CBT, then their symptoms reduced even further. Like we did that in a group of people with severe depressive disorders. Another point is that there was less dropout in the positive CBT group, and that all clients preferred positive CBT over traditional CBT. So these are very promising findings, and now I know that in Iran, for instance, they did a research with the positive group protocol, which has had very promising results for the group protocol as well. Okay, so you also asked me to talk a little bit about the book Practice in Positive Psychiatry. That's another new book by Hogrefe. So I wrote this book together with Professor Frank Peters from Maastricht University. Well, positive psychiatry is an addition to traditional psychiatry. It's not a replacement of traditional psychiatry, but it is an addition. You could call it the psychiatry of the future, or a new form of psychiatry, basically. And at least in the Netherlands, and maybe it's the same, I don't know where you live in Germany, but maybe other countries too, that increasingly people working in the psychiatry business, so to speak, and clients and patients are not satisfied with the way things are going, because most of what, let's say, traditional psychiatry does is symptom reduction. Well, this is also the medical model I was just talking about. With positive CBT, what's wrong here, and how do we repair what's wrong here? So we call it symptom reduction. And we, in our book, Practicing Positive Psychiatry, with foreword by Dilip Jester, he was a former APA president. He wrote a beautiful foreword for this book. We say, okay, there are two paradigm change and one culture change. The paradigm change being, the first one being focus on the person, not on the disease, which is different from what's happening in many instances right now, where you are focusing on the disease, not on the person. And the second paradigm being that apart from the medical model I was just talking about, there's the solution-focused model, which doesn't look backwards at what's wrong and how to repair what's wrong, but looks forward at what might be created, a new and better life for patients or for clients. And we also talk about the culture change in this book, because this means that things need to change in the education, in the training for psychiatrists, and people have to look at well-being much more than and just not only looking at symptom reduction. Mm-hmm. So two paradigms change, one culture change, also in education for psychiatrists and people working in the psychiatry field. So that's what we basically describe in this book. And we also describe in this book a chapter or American colleagues who wrote a very nice book on recovery-oriented approach. So we're very happy that Gerald Jordan and Larry Davison wrote a nice chapter on recovery-oriented approach, which basically says the same. Don't look at the disease, look at the person. So you might say, a nice quote might be, not what's the matter with you, but what matters to you. Positive psychology and positive psychiatry are trends diagnostic. So you can basically use it for any problem that people bring to the office.
We have discussed what makes them different from their traditional forms, or do you have anything else to add in this regard?
Well, I know that this might be interesting, that this is research from the solution-focused brief therapy part, that sessions are shorter, less sessions are needed, autonomy of clients is guaranteed, and there's less burnout amongst therapists, which I think is a very important finding, because, well, you can imagine that if you're working in an office and you're the only expert, and people come to you and tell what's wrong, and they look at you for the answer. Mm-hmm. And at the end of the day, you might be rather tired. And I think the client needs to work harder than you do as a therapist or psychiatrist, and so it might be very important if you want your work to be nice and do it for a long time. That many people say, and also clients say, okay, the tone is lighter, and because it's about what people do want, and it's about their preferred future, and it's about strengths instead of weaknesses, and it's about what exceptions to the problems instead of the problems. So it's a different atmosphere, it's a different tone.
Mm-hmm. And how can your books be beneficial for mental health professionals?
So, well, when I look at the study we did about positive CBT, all clients preferred positive CBT over traditional CBT. And we've got many lovely quotes in the book. Both books were published in Dutch first, and now they're both published in the English version. And so they might be beneficial not only for us, but also for our clients. Like Professor Raas from Belgium, his quote is at the back of the book, and he says, positive CBT offers a different approach, not only for our clients, but also for ourselves, therapists. as an antidote against burnout and general negativity. And I think he hits the nail on the head with that book.
And therefore, do you have any further comments, any summary to add?
Well, I might add a quote from a client, which is also on the back of the book. And one client who participated in our study, she said, "Now I am really building the life that I want." And another client said, "I've noticed that when you focus on the things that are going well, the things that are not going well will automatically get smaller." These are just a few statements from clients who participated in our study at Maastricht University.
Great. Then thank you so much for this interview, and I hope you have a lovely rest of the day. And yeah, thank you very much.